Hello, I'm Dr. Stuart Mason, Medical Director of the Gynecologic Minimally Invasive Surgical Program at Clovis Community Medical Center. In the past 20 years, we have made many advances in surgical techniques that offer better, safer care for women. One of these procedures that you should know about is the minimally invasive hysterectomy.
Approximately 600,000 hysterectomies are performed each year in the United States. A traditional or open hysterectomy requires a 4 to 8 inch incision in the abdomen that allows access to the organs being operated on. Recovery time lasts about 6 weeks or longer, depending on the patient's condition, and will require at least 1 to 2 days in the hospital. Although a traditional hysterectomy might still be required in some cases, a safer, less painful alternative often is available. A minimally invasive hysterectomy requires just 3 to 4 small incisions for long, thin instruments to pass through. The uterus is operated on inside the abdomen and can be removed through one of the small incisions. This technique reduces bleeding, leaves little to no visible scarring, greatly decreases the risk of infection, lessens pain, and shortens recovery times to as little as 2 weeks. Minimally invasive procedures are typically done on an outpatient basis, but in some cases may require an overnight stay in the hospital.
Surgeons started the Gynecologic Minimally Invasive Surgery Program at Clovis Community Medical Center to ensure women in the Valley have access to the finest, safest, and most advanced surgical techniques possible.
The discussion that Dr. Mason and I had after deciding that this was something that I wanted to do was he had just proposed to me if I wanted to have a hysterectomy that the best possible procedure for me would be the laparoscopic hysterectomy. And he explained to me that it was a very quick procedure, the recovery time was very quick, and that it was not a real invasive procedure whatsoever.
Patients and surgeons are happy with the result. We're specially trained in these techniques. About 95% of hysterectomies performed by a surgeon in our program are minimally invasive. The national average is only 50%.
It was awesome because it was an in and out procedure. I was in the hospital for just a couple of hours and was released the same day of the procedure. After 2 weeks, I went back to work.
To me, that represents a lot of women healing and returning to activity faster. It's safer and simply a better way to go. The laparoscopic hysterectomy has provided a platform allowing women to get back to their lives quicker.
Being that I do have young children, if I had the traditional hysterectomy, I would have been down a lot longer. I wouldn't have been able to lift them up, wouldn't have been able to bend down to their level. It really would have restricted me from being able to take care of my children. And by having the minimally invasive one, I was able to do all of those things within a day or two after the surgery. If I were to recommend to somebody that was considering having the surgery, I would tell them that the best thing would be to have the minimally invasive hysterectomy versus the traditional, based solely on the fact that you're not in the hospital that long, the recovery time is not that long, you're back on your feet in no time, and there's just truly no comparison between the two surgeries. And to me, I don't see why someone would even want to choose to have the traditional way done versus the minimally invasive way done, because there's so many benefits to the minimally invasive procedure. Clovis Community is a great hospital to have it done. They have great staff there, and very caring and attentive staff. And they want to make your experience there at the hospital a good one.
While we have been talking about laparoscopic hysterectomies as the procedure of choice, your situation may not allow for that. You should always talk to your physician and come into an agreement on what procedure is right for you.